Hi, I'm Michelle Risser, and I'm a licensed therapist, and let's go over somatic OCD. In this video, we'll talk about the definition of somatic OCD, common symptoms of somatic OCD, examples of somatic OCD, and somatic OCD treatment. What is somatic OCD? Somatic OCD, also sometimes called sensory motor OCD, is the obsessive awareness of bodily functions that keep us going, like breathing, swallowing, and blinking. People with somatic OCD struggle with being unable to not notice these body sensations. Once the awareness sets in, it's really hard to stop, so trying to suppress the thoughts won't help them go away. For example, thinking you're making too much eye contact with someone, or noticing that you're swallowing too often, and that something might be wrong when it's really not. People can also develop mental rituals called compulsions, along with the obsessive thought. These could be things like trying to control the pattern of their thought, counting how many times the behavior occurs, or attempting to distract themselves. These rituals are not actually helpful because they focus further on the ideas and the desire to control them. Other types of body and health-focused disorders that can overlap with somatic OCD include orthorexia, which is a lifestyle devoted to excessive pureness of food and eating; body dysmorphia, which is a focus on being unattractive; muscle dysmorphia, which is a focus on not having a big enough physique or enough muscles in the right places; and emetophobia, which is a fear of vomiting. To learn more about body and health-focused disorders, we'll go ahead and link articles that we've published in the description below. The OCD symptoms of somatic OCD involve persistent awareness of bodily functions that are usually unconscious. This becomes a clinical problem when it starts interfering with life, and when the distress level becomes unmanageable due to the inability to focus on anything else. Somatic OCD involves obsessions revolving around things like blinking or looking at someone, too much eye contact, swallowing, breathing, your heart rate. Examples of somatic obsessive thoughts could include, what if I never stop noticing these body sensations? What if I go crazy? What if I don't chew my food enough and choke? Maybe there's a reason I'm supposed to notice this behavior. Somatic OCD compulsions due to trying to focus on or avoid the obsession include distraction or avoidance behaviors, compulsive counting, like how many times the symptoms are happening, things like blinking, swallowing, heart rate, checking your pulse, staring, asking other people if they notice the behavior, seeking reassurance. Somatic OCD becomes a clinical problem when it starts interfering with life and when the distress level becomes unmanageable due to the inability to focus on anything else. Let's go over some examples of somatic OCD. Someone with somatic OCD might look uncomfortable or distressed during interactions due to being preoccupied with physical symptoms. Someone who's hyper-aware of swallowing may appear to swallow more than usual. Here's another example of hyper-awareness. A woman with somatic OCD might have trouble at work and in her social life due to a fear that when she talks to women, she could be perceived as looking at them inappropriately. Although she continues to perform at an excellent level at work, the quality of life suffers due to the high level of distress she experiences in the presence of her female coworkers. She anticipates family and social events with dread. Somatic OCD treatment. If you are not able to focus or function in everyday life, it's likely that the problem will persist and that you'll need professional help. Here's how to seek professional help for somatic OCD. Ask for a referral from your primary doctor, find an OCD specialist using an online directory, or call your insurance company for a list of mental health providers. We've linked resources in the description below to help you find a therapist, psychiatrist, and other helpful tools.